Healthcare providers are now looking ahead and trying to prepare for the Affordable Health Care Act. This morning, two major healthcare leaders here in central Indiana announced a partnership that they say aims to make sure that any Hoosier who wants health care will be able to get it. Our Health Beat anchor Anne-Marie Tiernan is back from that morning announcement to explain what this means for us. Hi, Ann.
Well, hi. And it was a very emotional morning for the heads of these agencies because the EMS workers work for Eskenazi Wishart, and so they had to find this line between, their mourning for that and also their excitement about the deal announced today. The heads of Community Health Network and Wishart Eskenazi Health today announced that they are coming together and forming a partnership. It is a major undertaking. They'll be headed up by this guy, Brian Mills. He is the current CEO of Community Health Network. The new Wishart right now has about 1,000 physicians, Community roughly 500. And Community is providing care in 80 locations, Eskenazi roughly 31 sites. The goal, Mills says, is to make it easy for patients, no matter where they are, to seek care and get it.
I think the worst thing that could happen would be that somebody who has not had insurance all of a sudden has insurance and they can't get in someplace to use it. I mean, that's wrong. And that's how our system's set up. So we've been trying to form partnerships, like the partnership announced a few weeks ago with Walgreens. Okay? Some people would say, well, aren't you competitors? Well, no, we need to find a way to reach out with those people. So when somebody goes into a Walgreens clinic, it'll be like being in community, and again, information flows. So when I think of health reform, I see this unbelievable responsibility to create a funnel big enough that anybody can get in.
And it's more than just these two organizations, right?
Well, that's right. Each organization has their own partnerships, and then they're coming together in this partnership. It's important to note that because of this deal, there's no name change. There's no exchange of money here. This is not a merger. It is, however, a pooling of resources. Eskenazi, of course, is known for trauma care and burn care here. Community has its stellar cardiovascular and cancer care. And then they have all the partnerships separately, some with students, some with schools. And they're adding those now to make sure there are enough medical providers and staff as they look ahead. The list of impacted agencies is extensive.
For Wishart, we bring the IU School of Medicine, with which we've had an over 100-year partnership. Community is in partnership with the Marian University College of Osteopathic Medicine. We have relationships with the IU School of Dentistry, IU School of Nursing, Ivy Tech School of Nursing, Butler College of Pharmacy, Purdue College of Pharmacy, Ball State School of Nursing, Fairbanks School of Public Health. This is, it's really the extraordinary array of all these partners. I think this is what health reform is about.
And so you're really talking about more opportunities for training in all these medical fields, Scott, and also maybe a pooling of resources when it comes to grants. When you look ahead about the Affordable Care Act and the full implementation in 2022, and you're talking about 33 million patients across the country who will now have access to care that don't have it now, you need to make sure there's enough pharmacists, enough doctors, enough nurses, and they hope that this partnership provides part of the piece of that puzzle as well.
We'll get more on this story tonight on the Health Beat.
That's right. And actually, we have extended interviews with some of the leaders, Dr. Harris and Brian Mills, and also Virginia Kane, that we're putting up for you on the web this afternoon so you can see from their perspective what this means for health care in central Indiana.
Again, all that on WTHR.com. Ann, thanks.
Yep.